Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Do vaccines contain aborted fetal tissue? Vaccines and aborted fetal tissue are linked in some cases. That's because certain vaccines, such as a type of rabies vaccine, are made by cultivating the virus in fetal cells. The Janssen COVID-19 vaccine, no longer made by Johnson & Johnson, was developed using cells from a fetus aborted in 1985. The AstraZeneca COVID vaccine relied on tissue from 1972/R/N/R/N. Some fetal cells have been used in research since the 1930s. However, the sourcing remains controversial for some due to the abortions that made the fetal cell lines possible. Not all vaccines are developed by using fetal cells, but others remain an ethical concern, including common childhood vaccinations and more rare types like the Ebola vaccine. /R/N/R/N illustration by Nushu for Verywell Health /R/N/R/N fetal cells were originally used because viruses tend to grow better for research purposes. The advantages of using fetal tissue include /R/N/R/N fetal cells can be kept at cold temperatures using liquid nitrogen. These qualities make it possible for scientists to continue using the same fetal cell lines that were originally created decades ago. /R/N/R/N vaccine manufacturers obtain human cell lines from FDA-certified cell banks. After processing, very little, if any, tissue remains in the vaccine. Vaccines do not contain fetal cells. Researchers continue to develop new therapies and treatments based on fetal cell lines. /R/N/R/N vaccines that are developed from the cell lines of aborted fetal tissue include /R/N/R/N. In some cases, alternative vaccines may be available, as is the case with the mRNA-based Moderna and Pfizer COVID-19 vaccines, or the Abovert rabies vaccine cultivated from chicken fibroblasts. /R/N/R/N Your healthcare provider can help if you want to learn more about the alternatives or have specific concerns. /R/N/R/N Neither the Moderna nor Pfizer COVID-19 vaccines were produced using fetal cell lines. Researchers, including AstraZeneca and Johnson & Johnson teams, used at least 2 cell lines from human fetal tissue aborted years ago, in 1972 and 1985, while working on 6 possible COVID-19 vaccines. No new abortions were involved. /R/N/R/N One vaccine myth that emerged from the COVID-19 pandemic was the concern that the mRNA vaccines, Moderna and Pfizer products, could change your DNA once it entered the cells in your body. /R/N/R/N There is no risk of that occurring with these vaccines. Neither vaccines nor aborted fetal tissue used to develop them in the laboratory can alter your DNA. Further, there ultimately is no aborted fetal tissue in vaccines because of the manufacturing process of the product. /R/N/R/N Researchers continue to develop alternatives to fetal tissue in developing vaccines, including the use of adult stem cells and pluripotent stem cells, genetic ally reprogrammed adult cells. /R/N/R/N Some vaccines are created by growing the viruses in fetal embryo cells. These cells came from tissue obtained from fetuses that were aborted in past decades. The cells continue to grow in a laboratory and are still used to create some vaccines today, including the common MMR vaccine. /R/N/R/N If you have concerns about any recommended vaccine, your healthcare provider can help you learn more about what's inside the vaccine. They can also provide information about alternative vaccines created from animal cells instead of human cells for people who have ethical or religious concerns. /R/N/R/N Get our printable guide for your next doctor's appointment to help you ask the right questions. /R/N/R/N Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. r/n/r/n. Thank you. Form.email, for signing up. r/n/r/n. There was an error. Please try again. r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.